Throughout history, humanity has lived side by side with diseases. Today, we are used to hospitals, doctors, medicines, and vaccines, but it was not always like this. Just a few hundred years ago, even an ordinary cold could lead to death, and an unknown disease could wipe out an entire city. Pandemics are not just outbreaks of illness. They are events that changed the course of history. They destroyed states, stopped wars, and caused fear, panic, and despair. People did not understand why their loved ones were dying and often blamed God, stars, or one another. In this article, we will recall the most terrifying pandemics in human history, learn how they began, how people fought against them, and what lessons they left for future generations. The Black Death, the pandemic that changed Europe. In the middle of the 14th century, one of the deadliest diseases in history swept across the world, the plague, better known as the Black Death. It is believed that the disease began in Asia and reached Europe through trade routes. Merchants, ships, and caravans all helped the plague spread farther and farther. At that time, people knew nothing about bacteria or microbes. They did not understand that the disease was carried by fleas living on rats. To them, the plague seemed like a punishment from heaven. The plague developed very rapidly. A person's temperature rose suddenly. Severe weakness and headaches appeared. Then, painful black swellings, buboes, formed on the body. This is where the name Black Death comes from. In many cases, a person died just 2 to 3 days after the first symptoms appeared. Within a few years, the plague destroyed about 30 to 60% of Europe's population. In some cities, entire streets died out. There was no time to bury the dead. Bodies were simply piled into mass graves. Many villages disappeared from the map. Fields became overgrown, houses stood empty, and the economy collapsed. According to rough estimates, more than 25 million people died. Because the causes of the disease were not understood, people searched for someone to blame. Persecutions began, religious fanaticism grew, and violence spread. Some people prayed for days on end, while others went to extremes, believing that the end of the world was near. Yet, it was after the plague that the first attempts at quarantine and isolating the sick began. An important step toward the future of medicine. Smallpox, a disease that tormented humanity for thousands of years. Smallpox is one of the oldest and most terrifying diseases in history. It accompanied humanity for thousands of years. People suffered from smallpox long before the emergence of modern medicine, and for a very long time this disease was considered an inevitable part of life. Traces of smallpox have even been found on the mummies of ancient Egyptians. This means the disease already existed several thousand years ago and managed to leave a bloody mark on the history of almost all civilizations. Smallpox began suddenly. A person's temperature rose sharply, severe weakness, headaches, and body aches appeared. After a few days, the body became covered with a rash. At first these were small spots, then they turned into fluid-filled blisters, and later into pus-filled sores. The person's face and body were completely disfigured. Even if the patient survived, deep scars remained on the skin forever. Many people lost their eyesight or were left disabled after the disease. On average, smallpox killed 1 out of every 3 infected people. Among children, the death rate was even higher. People feared smallpox more than war and famine. Parents hid their children, cities closed their gates, and the sick were isolated as best they could. But stopping the disease was almost impossible. Smallpox played an especially tragic role during the age of great geographical discoveries. Europeans brought the disease to the Americas, where indigenous peoples had no immunity. Entire civilizations, the Aztecs, Maya, and Incas, were destroyed not so much by weapons as by smallpox. Millions of people died in a short period of time. This became one of the largest demographic catastrophes in human history. Long before vaccines appeared, people searched for ways to protect themselves. In some countries, variolation was practiced, the deliberate infection with a mild form of smallpox. The method was dangerous but sometimes saved lives. It was the first step toward understanding immunity. At the end of the 18th century, the English physician Edward Jenner made a discovery that changed the world. He noticed that milkmaids who had contracted cowpox did not become infected with smallpox. Based on this observation, the first vaccine in human history was created. Vaccination against smallpox spread slowly, but gradually reached more and more countries. The struggle lasted almost 200 years. And only in 1980 did the World Health Organization officially declare smallpox had been completely eradicated. Smallpox is the only infectious disease that humanity has managed to defeat completely. This became a symbol of the power of science and international cooperation. Millions of lives were saved thanks to vaccination. The Spanish flu, a pandemic that struck suddenly. In 1918, the world had already been living in a state of war for several years. World War I was coming to an end, but people were exhausted. Hunger, cold, devastation, overcrowded hospitals, and millions of soldiers constantly moving between countries. And it was at this very moment that a new disease appeared, influenza, which would later be called the Spanish flu. It emerged suddenly and began spreading at a frightening speed. Soldiers became infected in barracks, on the front lines, on trains and ships, and then brought the disease back home with them. The world was completely unprepared for a new pandemic. Why was it called Spanish? In fact, the Spanish flu did not begin in Spain. During the war, most countries concealed information about outbreaks in order not to undermine morale. Spain, however, was a neutral country and freely reported cases in its newspapers, including the infection of the king. Because of this, people got the impression that the epidemic had started there. This is how the name Spanish flu appeared, although it is incorrect. Symptoms of the disease. The symptoms of the Spanish flu were terrifying. A person's temperature rose suddenly, severe weakness appeared, along with headaches and muscle pain. Many people felt as if they were literally suffocating. In some patients, the skin turned bluish due to a lack of oxygen, and the lungs filled with fluid. In severe cases, a person could die in just a few days, and sometimes within only a few hours after the first signs of the disease. The most frightening thing was that the illness often affected not the elderly and weak, but young, strong people. Who was most at risk, unlike ordinary influenza, the Spanish flu was especially dangerous for people aged 20 to 40. It is believed that a strong immune system in such individuals reacted too aggressively, causing the body's own tissues to be destroyed. This came as a real shock. Soldiers, workers, mothers and fathers of young children, people who had seemed healthy just yesterday, were dying. Scale of the tragedy. Within 2 years, the pandemic spread across almost the entire world. According to various estimates, about 1/3 of the world's population became infected, and the death toll ranged from 50 to 100 million people. In some cities, there were not enough doctors, coffins, or space in cemeteries. Funeral processions took place every day, and sometimes the dead could not even be buried in time. Life during the pandemic cities were changing before people's eyes. Schools, theaters, and churches were closed. People were forbidden to gather in groups. On the streets, one could see people wearing gauze masks, the forerunners of modern protective equipment. Many were afraid to leave their homes. Public transportation operated irregularly, hospitals were overcrowded, and there was simply no cure for influenza. Reaction of authorities in society. Authorities tried to stop the spread of the disease, but there was almost no experience in dealing with pandemics on such a scale. There was a lack of reliable information, and rumors spread faster than the disease itself. Some people did not believe in the danger, others panicked, and some searched for miracle cures. All of this only made the situation worse. The end of the pandemic and its lessons. By 1920, the Spanish flu gradually began to fade. The virus mutated, people developed immunity, and isolation measures began to work. But the world was already different. Millions of families had lost loved ones, and an entire generation was traumatized by the horror they had endured. The Spanish flu showed humanity just how dangerous viruses can be. It was after this pandemic that medicine began paying much greater attention to epidemiology, virology, and disease prevention. Many measures that seem familiar to us today, quarantine, masks, and restrictions on mass gatherings, appeared precisely at that time. Cholera, a disease of dirty water and poverty, cholera became one of the most frightening diseases of the 19th century. At that time, cities were growing rapidly, people were moving en masse to factories and industrial centers, while living conditions remained a gastronomy. There was no sewage system in homes, and drinking water was taken from rivers into which waste was also discharged. It was in such an environment that cholera began to spread at an enormous speed. The disease appeared suddenly and could strike entire cities within just a few weeks. The homeland of cholera is considered to be India, the region of the Ganges River. From there, the disease spread around the world with traders, soldiers, and ships. During the 19th century, humanity experienced several waves of cholera pandemics that affected Europe, Russia, Africa, and the Americas. Cholera acted quickly and mercilessly. A person developed severe diarrhea and vomiting. The body rapidly lost water and salts. The patient literally dried out within a matter of hours. Without treatment, a person could die within a single day, sometimes even faster. What was especially terrifying was that the disease often progressed without pain. The person simply weakened and faded away before the eyes of others. During cholera outbreaks, the death rate was enormous. In some cities, tens of thousands of people died within a few months. Hospitals were overcrowded, there were not enough doctors, and effective treatment did not exist. People were afraid even to touch the sick. Panic gripped cities. People believed that cholera was spread by poisonous vapors, bad air, or conspiracies by the authorities. Riots, pogroms, and distrust of doctors began. At times, crowds attacked hospitals, believing that doctors were deliberately poisoning patients. A turning point. In the mid-19th century, the physician John Snow made a crucial discovery. He noticed that cholera outbreaks were linked to a specific water source. When a contaminated water pump in London was shut down, the number of cases dropped sharply. This became the first proof that diseases can be transmitted through water. Lasting consequences. After the cholera pandemics, cities began building sewer systems, purifying water, and improving sanitation. Cities gradually became cleaner and safer. Cholera, as frightening as it sounds, pushed humanity toward the creation of modern public health systems. Cholera has not disappeared completely. It still flares up in poor regions where there is no access to clean water or proper medical care. However, today, the disease is easily treatable if help is provided in time. The key factors are access to clean water and basic health care. Cholera showed that human health is directly connected to living conditions. Clean water, sanitation, and hygiene save more lives than any medicines. This pandemic taught the world that prevention is sometimes more important than treatment. AIDS, a pandemic of fear, misunderstanding, and long struggle. At the end of the 20th century, humanity faced a disease unlike any previous pandemic. It did not spread through the air or water and did not kill within a few days. Yet this was exactly what made it especially frightening. This disease was HIV, the human immunodeficiency virus. When the infection reaches an advanced stage, it is called AIDS. The first cases were recorded in the late 1970s and early 1980s. Doctors noticed unusual illnesses in young people whose immune systems suddenly stopped functioning properly. What are HIV and AIDS? HIV is a virus that gradually destroys the human immune system. AIDS is the final stage of the infection, when the body is almost unable to defend itself against other diseases. A person does not die from the virus itself, but from common infections that a healthy immune system would normally defeat easily. The early years of the pandemic. At first, almost nothing was known about HIV. There were no tests, no medicines, and no clear understanding of how the virus was transmitted. The disease spread through blood, unprotected sexual contact, and from mother to child. Because of the lack of information, the virus quickly spread beyond individual countries and became a global problem. Fear and stigma AIDS became not only a medical, but also a social catastrophe. People with HIV were feared, avoided, fired from their jobs, and expelled from their families. The disease was surrounded by myths. Many believed it could be transmitted through touch, shared dishes, or the air. This fear and misunderstanding cost thousands of people not only their health, but also their human dignity. Scale of the tragedy. Since the beginning of the HIV pandemic, more than 40 million people have lost their lives. Tens of millions are living with the virus today. The disease hit African countries especially hard, where access to treatment was limited for a long time. From a death sentence to treatment. In the 1980s and early 1990s, an HIV diagnosis sounded like a death sentence. People often lived only a few years after infection. Medications appeared slowly, were often expensive, and had limited effectiveness. Many patients did not live to see a real breakthrough in treatment. A turning point. In the late 1990s, antiretroviral therapy was developed. It does not completely destroy the virus, but it prevents it from multiplying. A person living with HIV who takes medication can live a long and full life work, start a family, and have healthy children. HIV today. Today, HIV is a chronic disease, not a death sentence. In many countries, medications are available free of charge. However, the pandemic is still ongoing. Every year, millions of people become infected, especially in regions where education and healthcare are lacking. COVID-19, the pandemic that brought the modern world to a halt. At the end of 2019, alarming reports about an unknown disease began to appear in the news. At the time, few people paid serious attention to them. It seemed like just another local outbreak that would quickly fade away. But within a few months, it became clear that the world was facing a new global threat. The disease was named COVID-19, and it was caused by a new coronavirus. What once felt distant very quickly became part of everyday life for millions of people. COVID-19 was transmitted mainly through airborne droplets. A cough, a conversation, or close contact was enough. The modern world, with airplanes, megacities, and constant movement of people, became the perfect environment for the rapid spread of the virus. Within weeks, the disease had reached almost every country. For some people, COVID-19 was mild, like a common cold. For others, it caused severe pneumonia, high fever, loss of taste and smell, and extreme weakness. In severe cases, patients required oxygen support or mechanical ventilation. Many did not survive, especially the elderly and those with chronic illnesses. During the first years of the pandemic, hundreds of millions of people were infected worldwide. According to official data, millions died, but the real number of victims was likely higher. The pandemic touched almost every family. Some lost loved ones, others lost their health, jobs, or familiar way of life. COVID-19 changed everyday life. Borders closed, events were canceled, and city streets emptied. People stayed at home, working and studying remotely. Masks, hand sanitizers, and social distancing became part of the new reality. Many people felt for the first time how fragile the familiar world truly is. Healthcare workers found themselves on the front lines. They worked without rest, often risking their own lives. Hospitals were overwhelmed, lacking equipment, protective gear, and staff. Many doctors and nurses became ill and died themselves. Their work became a symbol of human dedication and self-sacrifice. One of the greatest achievements of the pandemic was the rapid development of vaccines. In record time, scientists managed to create and deploy protection against the virus. Vaccinations significantly reduced mortality and the severity of the disease, although debates and fears accompanied the process throughout. The pandemic affected not only physical health but also mental well-being. Loneliness, anxiety, and uncertainty became common feelings. Many people came to appreciate the value of communication, simple walks, hugs, and meetings with loved ones. Today, the pandemic no longer seems as frightening as it did at the beginning, but the virus has not disappeared. It continues to circulate, mutate, and remind us of its presence. COVID-19 has become part of our reality, much like influenza once did. Conclusion: the history of pandemics is a history of pain, fear, and enormous loss. Plague, smallpox, cholera, Spanish flu, AIDS, and COVID-19 have taken millions of lives and forever changed the course of history. Each of these diseases arrived suddenly, caught humanity off guard, and revealed how vulnerable we are to the forces of nature. But along with tragedy, pandemics have always brought change. They forced people to search for answers, to develop science, medicine, and healthcare systems. After every major epidemic, the world emerged different. Quarantines, sanitation standards, vaccines, new medicines, and a deeper understanding of how the human body works appeared. Pandemics also reminded us that diseases recognize no borders, nationalities, or social status. In the face of danger, all people are equal. That is why fighting epidemics always requires collective effort, from doctors, scientists, governments, and ordinary people. History shows that humanity has stood on the edge many times and survived. We lost millions, but gained knowledge and experience. And that experience is our strongest shield against future threats. The memory of past pandemics is not just a page in history. It is both a warning and a source of hope. As long as people continue to learn, help one another, and trust science, humanity has a chance to overcome any disease, no matter how terrifying it may seem.